Before using Tacrolimus ointment, make sure to read the medication guide provided by your pharmacist. Remember to wash your hands with soap and water before applying the ointment to the affected areas of your skin as directed by your doctor. This is usually done twice daily. Gently and completely rub the medication into the skin, and wash your hands afterward unless they are being treated. If your doctor advises using a moisturizer, apply it after the medication. It's important to note that this ointment is for use on the skin only. Avoid getting it in your eyes, nose, or mouth, and if you do, rinse with plenty of water. Do not apply the medication to open wounds or infected areas, and do not cover the treated area with plastic or waterproof bandages unless directed by your doctor. Also, avoid bathing, showering, or swimming right after applying the medication, as this could wash it off the treated area. Follow your doctor's instructions exactly when using this medication. They may advise you to stop using it once your eczema has cleared, and to start using it again if symptoms reappear. If your condition does not improve after 6 weeks of using the medication, or if it worsens at any time, be sure to inform your doctor. During the first few days of using Tacrolimus ointment, you may experience stinging, burning, soreness, or itching in the treated area. Other possible side effects include headache, acne, small red bumps on the skin, folliculitis, stomach upset, and flu-like symptoms. Some people may also experience increased sensitivity of the skin to hot/cold/pain/touch. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects, but it's crucial to remain vigilant and report any unusual symptoms to your doctor promptly. If you experience any serious side effects such as unusual tiredness, back/joint/muscle pain, appearance of skin infections or sores, or chest pain, contact your doctor immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you experience any adverse effects, be sure to seek medical advice. Before using Tacrolimus ointment, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical conditions you may have, such as swollen lymph nodes, skin infections, or kidney disease. It's important to note that this medication can make you more sensitive to alcohol and sunlight, so it's best to limit your alcohol intake and avoid prolonged sun exposure. Make sure to use sunscreen and protective clothing when outdoors to avoid skin irritation. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Tacrolimus ointment with your doctor before using it. As always, consult your healthcare professional for personalized advice. When using Tacrolimus ointment, it is important to be aware of potential drug interactions that may affect its effectiveness or increase the risk of serious side effects. It's important to keep a list of all the medications you are using, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not make any changes to your medication dosage without consulting them first. If someone accidentally swallows this medicine, it can be harmful. If they show serious symptoms such as passing out or having trouble breathing, it's important to call 911. Otherwise, contact your local poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. It's important not to share this medication with others. Use this drug only as directed by your doctor for treating your current condition. Do not save it for later use for another condition unless your doctor tells you to do so. In that case, a different medication may be necessary. In addition to using Tacrolimus ointment, it's a good idea to talk with your doctor about other ways to manage your eczema. This can include using moisturizers and taking shorter baths and showers. Remember, always follow your doctor's advice for the best results. If you forget to use Tacrolimus ointment, apply it as soon as you remember. If it's almost time for your next dose, skip the missed one. Just use the next dose at the usual time. Don't use a double dose to make up for the missed one. Remember to store Tacrolimus ointment at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.